I'm thrilled to share about my leadership project today, and I'll be focusing on case comparisons of the impact of country-level leadership on its public health and maternal newborn child health outcomes. Specifically, I'll be focusing on the role of women in health leadership, why it matters, leadership style, and contributions. My name is Folake Olayinka, and I'm the Immunization Team Leader in the Global Health Bureau, United States Agency for International Development. In this role, I oversee USAID's Global Immunization Team and its management. I provide technical direction globally and ensure high-impact bilateral technical assistance for immunization to partner countries. I also provide technical leadership for COVID-19 vaccine country readiness and delivery technical assistance in the Global Health Bureau. My vision is to have a global health community with increased value of women leadership and places them in key decision-making roles, including in time of health crisis. Let me share a few quick facts about my project. I'll be developing a set of case studies that will explore the intersection of political leadership and women health leadership in a range of countries. I'll be using the COVID-19 response as an exemplar and document the experience of women leadership roles in time of crisis. Despite many proven interventions in public health, several countries are not making sufficient progress, and women leadership contributions to health outcomes are not always valued or recognized. This project aims to highlight and amplify women health leadership behaviors and styles that bring about transformative change to global health priorities. 4 case studies will be developed to look at the effect of leadership on public health outcomes. Countries with strong leadership and high proportion of women in leadership, countries with weak leadership and low proportion of women in leadership will be examined. These scenarios will be explored in both low-income and high-income country contexts. I'll seek to answer questions in 4 main areas. What proportion of women in health and political leadership were involved in COVID-19 response or maternal child health programs generally? What roles do women play? And specifically explore the decision-making roles of the women in the COVID-19 response or in maternal and child health programs generally. I'll be describing if the involvement of women in the country response was perceived as important and in what ways. What were the enablers and barriers? And also, I will find out what are the expertise and leadership approaches that women brought that were different from men. Here are some early results. What women brought to the table. Communication. Women bring unique communication skills and have the ability to connect with diverse audiences in a relatable way. Empathetic leadership. Women demonstrate empathy in crisis. At the same time, bring other skills needed to address emerging situations. Empathy is a critical leadership component in overcoming crisis. Leadership, partnership, and coordination. Women bring consistent focus, maintain concentration, and demonstrate ability to achieve the results. Ego is not a major issue for women, and as such, they can reach across several groups and build partnership needed to solve problems. Building trust. This is one of the most important elements for successful COVID-19 vaccines uptake and in maternal newborn child health programs. Women build trust at faster rates, and no matter how scientifically sound a program, communities and teams must trust the leader. The barriers that I've come across so far, the perception of women not being in charge, and also the issue of men undermining women's decision making. I'm still working on my leadership project, and here are some of my next steps. I'd like to finish conducting my key informant interviews, develop my case studies, and share them widely. And here's what I think will be the value add of my leadership project, that the findings will be important in showing how women play critical roles, particularly in time of health crisis. I aim to change the paradigm about women leadership and the value they bring to improving health outcomes. And also reinforce the key message. It is exactly the right decision to put women in leadership of health programs, and they are critical in time of health crisis. Thank you very much.